Herd immunity seemed to be the holy grail to ending this pandemic for a long time. The hope was that if enough people develop immunity to SARS-CoV-2 through vaccines and infection, the spread of the virus would slow down. And once the herd immunity threshold is reached, COVID-19 would gradually disappear from the population. Humans managed to get there at least once, in the case of smallpox, which were eradicated with the help of vaccines. But 2 years into this pandemic, we have to admit, this will not happen with SARS-CoV-2. Herd immunity now seems like a naive dream from the early pandemic days.
Because we've seen all these mutations and we're still understanding like how well this immunity that we may have works, it's really hard to think about getting to a point of herd immunity now.
If eradication through herd immunity is off the table, the more likely option is that COVID-19 becomes endemic at some point.
It means that still the virus spreads in society, can spread in society, and but not wildly, not everybody. So you would only see more or less outbreaks in special populations or in certain circumstances. But therefore, the effect on society is less, and that's what we call an endemic stage.
Endemic means the overall number of cases remains stable and therefore predictable, because vaccines and previous infections have created enough immunity to stop uncontrolled spread. We are actually living with many endemic diseases. The flu is one of them, or malaria and measles. So what would living with endemic COVID-19 look like? Scenario 1, COVID-19 turns into a seasonal risk that comes and goes in waves, just like the flu. Scenario 2, COVID-19 is permanently present in certain communities around the world, but case numbers are stable. Scenario 3, COVID-19 becomes a children's disease, with the first infection being the worst. Older people have less severe symptoms due to immunity they acquired through vaccines or previous infections.
Some of my colleagues would think that it will become just a very normal disease, and it will be one of many, which is the most likely scenario, and therefore we will deal with it like we're dealing with flu, for example.
So are we on the brink of this pandemic becoming endemic?
I think with what we've seen with COVID-19 thus far, it makes it really clear that we're not at the endemic stage yet.
I wish by the end of 2022 we will come to the endemic stage of this infectious period. But it depends on various other factors as well, on the side of the pathogen and side of society. And if a new pathogen, or if the pathogen evolves, or if we don't manage to vaccinate as many people as necessary, if we change our behavior, things can go differently. We can't be sure.
And endemic doesn't mean that a disease is not dangerous anymore. It can still be deadly for some. And it wouldn't necessarily mean the end of all protective measures either. Take the case of malaria. Sleeping under mosquito nets or taking anti-malarials are part of the routine when dealing with this disease.
I hope we will learn from this pandemic, and we will keep some of the good things which we have learned. For example, every year thousands of people died of flu. And now we saw that with hygiene measures, distance, and wearing of masks in populated places, flu almost disappeared. So we could certainly in the future maybe think about that some of these measures might be sensible.
So masks could still be a part of seasonal COVID-19 prevention, even in the endemic stage. But for now, we still need to focus all our efforts on actually getting there through vaccines and infection control.